Hey y'all, welcome back to the channel. It's a little cool here in the Midwest, but I'm still out here on the porch. Got my sweet tea and got my sweater on because it's just a little chilly out here. It's not too bad though, but I wanted to just sit down, take a minute, talk with y'all for a few seconds about the past week and what's been going on. Had a doctor's visit this week, and like some of y'all out there, maybe you take a pain medication, so do I. I've been seeing this doctor for a couple of months now, and he keeps having me come back every month. Well, I come to find out the clinic that they're associated with requires that I come back once a month to see him. But not only that, I have to take a drug test every 3 or 4 months, which I'm not used to doing because frankly, I mean, I'm not somebody who does that kind of stuff, and so I'm not, suspicious or anything. So the doctors usually don't require it from me. And I've only had to take like maybe three in the whole 12 years I've been taking this medications. But anywho, I did it, but I'm probably gonna be looking for another doctor because I'm used to only going to the doctor once every 6 months and 3 months max, but not every month, and that's just too much for me to do. I don't I just don't like going to the doctors and such. So probably gonna be looking for another doctor. I hate finding doctors, but I'm trying to work through and adjust some of my medications, and I'm actually trying to see if I can do something different, a different form of therapy, not physical therapy, but a different treatment plan to maybe hopefully get off of the pain meds because I've been on them for like 12 years, and I'm quite sure that they're I've built a tolerance to them, and I don't necessarily want to go up into the big boys yet. I'm just not ready for that. I don't want the scrutiny, honestly, is what it is. I just don't want to deal with the bureaucratic crap you have to go through with having it. Um, One day, I might get to that point where I don't have a choice, but right now I'm not quite there, so I do have a choice. So I'm just looking into some different things. We're trying some different things, and so I'm kind of a little edgy this week trying to adjust some meds and stuff. And yeah, it hasn't been fun. It hasn't been pretty. I've had a few meltdowns, a little less sleep than normal, but I'm getting through it. I'm not going to give up. I'm going to keep trying. So anyway, if you're new to the channel, thank you for joining us. This is PSA Warrior channel where I'm a warrior of psoriatic arthritis, and all I do is I try to come on once a week and talk about what's going on in my life, how this disease is, what it's doing, how it's doing for me, the things that I'm trying to learn, adjust, just day-to-day stuff. But I'm real. There's no editing. What you see is what you get. We don't need to say mean things about each other or comments because everybody's situation is different. There is going to be no two people alike, and no one situation is going to work for everybody. It's each individual disease that has to be managed. But all I'm trying to do is just learn and understand. I mean, for lack of a better term, what is quote unquote normal, or what is the just some things that are just common. One of the things that I struggle with is what is somebody like me supposed to do. I see all these things you see TV, you see people in your life and all these things that they do and how in their activities and the things in their, and I'm not gonna lie, I mean, I sit there and I think, holy, my goodness, I'm just wasting my life away, or I'm being lazy, or maybe I should try harder. And I've really had to learn. Okay, I am learning. I haven't learned yet. I am learning, but it's just been here recently. I've really, really, really started to learn, to try to understand and learn and remind myself that, hey, I'm not them. Yeah, I'm not old. I'm only 52 years old, but I'm not them. I'm not normal like they are. I'm not healthy. I have this disease that they don't have. And the one of the problems that I face with my disease is this disease is an actual invisible disease. If you look at me and you were to see me, you would think there's absolutely nothing wrong with me. But inside, there's a whole lot wrong with me. But on the outside, it doesn't. And it's so invisible that honestly, you know, even myself, even though I'm living with it, but even I sometimes have to remind myself that, hey, I do have this. Hey, you're not healthy and vibrant like what you're seeing. And so you can't do the things that they're doing. But I'm trying to learn, okay, so what is it that I can do? What is a healthy norm? And I know that I've read a lot of places and a lot of things where they say, just if the pain increases, then you know that you've gone a little too far and things like that. Of course, I know pain is a subjective matter. Pain to me is not the same pain as to someone else, or someone else doesn't make it any less painful. And it doesn't mean that there's anything wrong with any of us. It's just subjective. We're all different. This disease is different for everybody. It affects people differently. Like for me, it's in my neck. I have it in both of my shoulders, my elbows, my hands. I have the psoriasis on my hands as well as on the bottom of my feet, along with the disease. My knees, my hips. I have ankylosing spondylitis. Probably didn't say that right, but y'all know what it is. In my back, lower back. So I struggle to bend over. Sitting for long periods of time is not my friend either. I can't walk for long periods of times because both of my knees are bone on bone. I'm actually, needing 2 knee replacements, but I am putting that off just as long as I can, and hopefully, with a lot of prayer and changing my lifestyle and stuff, maybe I can make it and never have to have it done. I've had people tell me, that have had knee replacements, oh, do it, it's the best thing. But these people that have them had them because of a different something else, not psoriatic arthritis or, with the psoriasis. And I've read where, if my body, I'm afraid that if I have it done, actually my body's going to attack it and it's just going to send me into a flare that ain't nobody's business. And honestly, I'm in enough pain as it is, so hey, let's go add some more to it is not something that I find appealing. But so I'm just trying to keep going. I wear a little smart watchy thingy, and I try to walk a minimum of 2,000 steps a day. I used to have this 5,000 step goal, and yeah, all I was doing was hurting myself. So I got a little more realistic, and 2,000 is pretty good for me. So I try to make sure I walk 2,000, minimum of 2,000 steps a day. Um, Obviously, when I go to towns and stuff, I get a whole lot more than that, and I pay for it. But the goal is to stay active, yet not stay in bed for 3 days afterwards, or not cry myself to sleep because it hurts so bad. But I do try to keep going, and I try not to sit too long. Of course, I can't sit too long because if I do, I can't get up and get going. It takes me a little while, y'all. I got to get some WD-40 down in them joints when I stand back up if I sit too long. But I just try to keep going. The main thing is I keep going. These shoulders, I'm losing the what do you call it, range of motion or whatever that's in there, especially if I have anything in my hand, something just as simple as a tea jug, and oh my goodness. And I rubbing, not Aspercream. I use like a Tylenol Precise or something like that. But those joint rubs, I rub them on my knees and my shoulders, and just trying to keep going. And I'm still going. And but I still do things like I load the dishwasher and I do laundry, and I have a vacuum cleaner. I don't sweep because that's too hard on me, but I do have a vacuum cleaner that cleans my floors for me, even my hardwood floors. And I don't mop because it's too much pressure on my hands and my wrists and my shoulders and that. But so I don't do that too much anymore. I will occasionally, but I don't do it too much. But I still cook. I try to keep going the best I can. Some days, yeah. This week has been a tough week for me. It's been a pretty stressful week. We got a lot of stuff going on. We're right in the middle of selling our house where we used to live, and oh my goodness, there's just a lot of stuff going on. And of course, you add that little bit of stress on there, and man, the weather's bipolar here. I mean, we're in the 70s, and then I think last night we were in the 30s, and it's a little cool today. But and that barometric pressure, you know how it is. More goes to down the pain, up not so bad, down the pain. It's crazy. But so anyways, I'm just trying to work through it. I mean, heck, I got a glove on this hand because these are arthritis gloves, but I don't wear them for that. What happens is I get cracks. I can't see it, but I get cracks sometimes on these fingers where I push back, like I'll grab something and it'll just split. And man, oh man, it hurts. And so, best thing so far that I have found, what I'll do is I just take some bag balm is what I put on there, and then I bought some. I call it tattoo tape. It's that clear film that they put over tattoos. I don't have any, but I just know what it is. But anyway, and I put that over it. Then I put a little bit of sports tape like stuff on it, horse tape, and then I put this glove on there, and then I'll keep it on there, and it just seems to really help heal those cracks pretty quick. I mean, I've tried all kinds of stuff, y'all. But anyhow, not a whole lot other than that going on. It's been pretty calm. I was busy, really really busy Sunday, Monday, Tuesday, and Wednesday. Those are my husband's days off, and we were really busy. We went to town 2 full days, and not only that, the other 2 days we were busy here because we're trying to get some flowers and some gardening and mow and stuff. And I've been up on my feet a lot, and that's part of the reason why my knees are hurting so bad. I mean, oh my goodness, my knees are hurting, something fierce, and that's part of it. Is because I've been doing way too much walking. So these past couple of days, I've been trying to sit a little bit more than normal, trying to let these knees rest and try to get to feeling a little bit better. But man, they're hurting. But anyway, it's not going to be a very long one this week. Like I said, just a whole lot going on. But I wanted to just jump on here and just say, hey, I'm still here. Like y'all, I got my problems and my good days, my bad days, just like everybody else. But thank you so much for joining with me. And man, I just love. I know y'all aren't here or anything like that, but it's nice just to vicariously, virtually, so to speak, have people sitting on my porch just talking with me, and it's nice. And people that understand what I go through, and that can truly know what it feels like. It's very hard for me to explain to people what I feel like because you just say, I hurt. I mean, but that's not true. That's not what it is. It's much, much more than just I hurt. But it's such a hard thing to explain to people because they just don't understand. I mean, when you tell them how much hurts and all these joints that hurt, and people look at you like, oh, okay, aren't you exaggerating a little bit? That's a little excessive, but no one person can hurt that much. But it's true. We do. I do, and I'm sure that a lot of y'all do too. But anyway, like I said, I'm gonna keep this a little short. It's a little cool out here today, but I wanted to sit on the porch and just talk with you for a minute. And maybe next week I'll have a little bit, something more important to say or better to say or whatever. I'm learning as I go. This is new to me, and I'm learning as I go. And I'm trying to get better, and I will get better. Just stick with me, and hopefully we'll get to chit-chatting soon. And in the comments and stuff, and then we can talk about things like that. And like I said, I really do appreciate y'all listening, and hopefully soon, like I said, we'll get to talking and stuff. But anyway, until then, y'all take care of yourselves, and I will see you next time, and bye.